quiz.
Ma'am,
And
please
I was
be ready.
just taking over quiz.
We
Anything.
are live.
Yes.
We are
Thank
live.
Okay. Good evening, all. I welcome you all who have joined today for episode 321 of Gyan Pravah, that is Stream of Knowledge podcast series. ज्ञान का बहता रोजाना एक नया अनोखा रंग, ज्ञान का बहता रोजाना एक नया अनोखा रंग, हर रात 8 बजे जुड़िए आप फॉक्सी के संग. Actually, this is the theme with what we have started this podcast series. And our President Foxy, Dr. Sunita Madam, actually this is the brainchild of our President Madam, Dr. Sunita Tandulwadkar. I welcome you, Madam, our dynamic, dedicated and dashing President, I should say, President Foxy 2025, Dr. Sunita Tandulwadkar, who gave us opportunity to conduct podcast series throughout the year, and because of which we could bring celebrities working in the different field on Foxy platform. I welcome you, Madam. In spite of your busy schedule.
Alka. Thank you. Thank you so much. Alka, you are very sincere and kind-hearted lady we have. And I'm so happy to have a chairperson like you who always work out of the box. And Dr. Fernandez, welcome to this platform of Foxy. I join every day just 2 minutes to say hello to you, to show the respect that you are taking out time for Foxy and you are with us. And I'm sure health for all will be a very interesting, and it's my topic of my, favorite topic, one of the favorite topic, I should say. We love so much into the health industry. And the protocol is she will be having your interview, the podcast with you, and I'll be joining the viewers link and I'll enjoy the dialogue between both of you. So thank you once again for coming on Foxy platform. She has sent me your biodata. Of course, she should tell to all public before I this thing. But I read about you, and I'm so glad that she has chosen you, and you are giving time. It's honor to have you, ma'am. Thank you.
And one thing, Madam,
yes.
One thing about Sunita Madam, she was the one who had delivered a wonderful talk on human bill banking. And actually, this is my passion regarding human bill banking and IYCF activities. But I heard for the first time, because she is a very expert infertility person, but she talked on human bill banking. So I said, Madam, how I can? It was very surprising thing for me, a person who is an expert in infertility talking on human bill banking. That was during COVID era, I think. Okay, so
I know you remember Pune conference of Charu.
Yes.
Yeah. They wanted me to speak on, and it's okay. Thank you so much. Thank you, dear. Thank you. Thank you, Amitaji.
Thank you so much for joining. So let us begin with the podcast. But before that, some good lines for you, madam. Love what you do and do what you love. Passion is the key that opens the door to joy and abundance. These are the beautiful lines written by David Kusheri. Today we are amongst us a great speaker who is a passionate leader, a good Samaritan, and renowned neonatologist, Dr. Amina Fernandez, madam. I welcome you, madam, for today's podcast.
Thank you.
Actually, madam doesn't need, you don't need any introduction. I know that you are so popular amongst PPNI, IYCF, human bill banking members, and of course, neonatologists. But this is a formality for me to introduce you. She is a retired professor and HOD neonatology and retired dean LTMGH and LTMM College, that is Sion Hospital and College. She is a retired director, Holy Family Hospital, Mumbai. She started first human bill bank in India at Sion Hospital long back in 1989, and it is the very first human bill bank in Asia as well. She is a founder of popular NGO Sneha, that is Society for Nutrition, Education and Health Action. She is a founder of Romila Palliative Care Center. Her special interests are low-cost technology for survival of neonates, breastfeeding and human bill banking, health, nutrition and violence in women and children of the urban poor, underprivileged sector of class of people, and of course palliative care. Armida madam is a visionary leader and an inspirational statesman. It has been said about Armida madam that she walks her talk. She first does what she expects from others to do. Her work is her introduction actually. So let us begin with actually podcast with Madam. So I welcome you from this Fogsi platform. This platform is the people who have joined today are not only OBGYN, but they are from neonatology, IAP, Breastfeeding Promotion Network of India, Human Bill Banking, and even non-medicos. Because this is the topic that is raising health for all, is a topic of concern for everybody in the society, not only medicos, but non-medicos as well. So I welcome you once again from Foxy
My
platform.
pleasure.
Yeah. And so let us begin with the your questions, madam. Actually, the questions are like they will reveal your work. You have worked in so many fields, and that is the inspiration for all of us. But just to have a dialogue between you and me, I have framed some questions for you.
Okay.
Madam, Human Bill Bank at Sion Hospital is Asia's and of course India's first Human Bill Bank. It was established way back in 1989. After that, there are many Human Bill Banks in India. And I'm also fortunate that I was the National Secretary of Human Bill Banking Association around 4 years back. But the question is, what inspired you to set up this project? Actually, it was the beginning of Human Bill Banking in India. So, what inspired you to set up this project?
Thank you, Alka, for inviting me and for this great introduction. Uh, it is my pleasure, and whenever I get a chance to talk about work done, and if it inspires one or two people to do something in those areas that I work, I would be really very, very happy. So, when I started the Human Wealth Bank, as you know, it was in 1989. So, over 3 decades ago, let me tell you about over 4 decades ago. So, this is in the early 80s, late 70s. I was working in Sion Hospital. And Sion Hospital is a very large municipal hospital and medical college. And really, the poorest of poor, we always say the dying and the poor and the destitute are brought to Sion Hospital. So the mortality rates, we had 10 to 15,000 deliveries a year. Huge numbers of the poor patients came in late, and then the mortality was very high. And patients who were sick and dying were also transferred. So we had very high mortalities. We were struggling to bring down the mortalities of these babies. So in that struggle, you remember, Sion Hospital had large numbers, but they didn't have much finance in those days. I'm talking about 4 decades ago. Today it's a different picture. But at that time, there was no money at all. So I said, how can we save babies? And I had to use low cost technologies to save lives because there was no money. One of the technologies I used was I tried to find out what kills, why our babies die, and I found that a large number of our babies develop diarrhea. And following diarrhea, they got sepsis. And with sepsis, finally, they didn't make it. We didn't have all the antibiotics in those days that we have today. So they died. So I said, if we have to save babies, then we can't use these formula and bottles. So literally overnight in the 80s, I got rid of formula, I got rid of bottles, just got rid of them and stopped the animal milk. So how did we feed babies? We got mothers to come to the unit, feed the babies, and we also got them to express milk and keep in the fridge when they were not available. But then there were so many babies, so from one mother to another baby, this milk that was expressed was given. But when you are a doctor and a scientist, we realize that this is not the correct method. You just can't keep expressing, keeping in the fridge, keep giving from one baby to another. So then I had visited in UK and Oxford. I had visited a human milk bank, and that was run by a nurse, by the way. Huh? And I said, what we need is something like a human milk bank. So I came back to India, came back to Bombay, and I said, I must start a human milk bank. And that is the reason, of course, that is the reason why I started the human milk bank. And I only could start, municipality didn't have money to buy warmers for the babies or incubators. Human milk bank, they would never dream of. So when I got a donor to say, I will pay for the human milk bank. That's when I started. So it was only to save the lives of our preterm and sick babies that inspired me really to start the human milk bank.
Yeah. So that is the era, we should say beginning, or there are a dream of your what can happen with the future with the we don't set up human will bank. That is
Yes,
survival of the neonates rather.
correct.
Yeah. Madam, did you face any difficulty because it was the initial beginning era, as you say, any
I,
difficulty while setting that?
I had not one, but plenty of difficulties. First, the most common thing that people felt that I was not normal in my head. Said, what
Yes.
is this? What are you doing? Starting a human milk bank, taking milk from one mother to another baby. Fortunately, the head of our department, he said, no, you go ahead. And the dean at that time said, go ahead. So I had the support of
Of
admin
being.
in the hospital, the head of
Hmm.
department, Kathavdi, and the dean. But beyond that, no, because you won't believe even pediatricians outside my hospital, wherever, they said, how can you do it? You can't do this. So there was no trust. Really, they thought I was not okay. And the worst thing is that even there was a question in the Mantralaya government from Delhi, someone came to visit because there was a question put. Can you believe it? Why is the human milk bank set up? What is it? Is it okay to give? So someone luckily came and visited, and he just loved what we're doing. And after that, he was a doctor. He supported us much later, but he said, you're doing the right thing. And the last thing,
Okay.
the donor had given us money for the first 3 years. But then I had no money for staff. I needed money for the nurse, for the counselor, for the IF, for whatever we were doing. And to convince the people in the head office that you can give human milk. You know what I had to do, Alka? He
Mhm.
said, one mother's milk to another. How can you do it? Then I said, I reminded him about Krishna. I said,
Yeah.
Krishna was wet
Fed
nurse.
by.
Suddenly, it struck him that yes, there can be wet nurses where one mother can feed
Another.
another baby. So they took a lot. I can't tell you, lot of convincing, but I think it was worth because at one milk bank. And remember, for 20 years, 20, 30 years, there were no human milk bank. One, two,
Yes.
three. That also my students,
Yeah.
KEM and
Yes.
JJ, they
Yeah.
started. But now, of course, it's become a very fashionable, and you have over 100 milk banks all over. But I think that effort was worth. But what was the effort worth it? Because they're saving the lives of babies,
Yes.
especially the preterm and the sick.
Yeah. Yeah, madam. That was actually pioneer work done by you, and now we can see your dream has been fulfilled by because of our continuous hard work, you should say. And the
Yes.
collector was ready to accept in our district also. We have now three human bill banks. In Vidarbha
Ah,
also there are around six human bill banks. So the
wow.
number has increased. And the thing is that people are taking advantage of this human bill bank. But initially
Ah,
it was what you said, how to accept the milk from another lady or another
right.
mother. But when
Correct.
you said totally, they must have thought of Krishna and Yashoda and Krishna and
Yes.
Devi like that. That was
Yeah.
the thing that they got persuaded that we can have other mothers' milk.
Correct.
Madam, nowadays we see many human milk banks. Okay, that's wherever essence is there, our because of the constant efforts by pediatricians, OBGYN, of course, BPNI philanthropist, that we have developed a network like we should have one human bill bank at Essential, wherever Essential is there.
Yes.
But
Yes.
yeah, but I think there are certain things like there are certain challenges, there are threats. Like some companies, they have started using breast milk for making
Oh,
some ornaments from medicines and again commercialization of the human milk. So what are your comments on this? This is
I'll tell
misuse
you.
of,
I
yeah.
think in a way it is really criminal to allow this because there is no regulation. So
Mhm.
when the companies say, I'm giving you human milk, is it first, my first question, is it really human milk? Secondly, from whom is it collected? Have they done the test for HIV? Have they done tests for hepatitis and things like that in that patient? How is it collected? How sterile is it? How have they autoclaved? So there is no regulation at all. So we don't really know who the donors are. So I
Yeah.
think it is very correct, and it is not only I would say unethical, but is I would say illegal, and it is I think
Illegal.
time that
Crime.
at the time that the government puts in a regulation to ensure. And you know what happens? We really don't know who's making it. It's mostly online. And people who want, if I have a preterm baby, we have done so much of advocacy for human milk. They want that human milk. I can't for some reason because they don't have enough support. If they had enough support, they would have all been able to breastfeed. But if they can't and the baby is very preterm, they're desperate. And in that desperation, they're going online and they believe whatever they get, but they don't really know what it is. So I think there must be a regulation and we must make sure
Yes.
that they are very careful what they get and all. And this shouldn't be allowed unless it is well regularized, well collected and safe with the right contents of the milk.
Yes, exactly. So we should have some laws so that it will govern, control this unethical, I can say illegal practice, or it's a crime
Yeah,
actually. What they are
yeah,
doing is a like crime, though there is no law as such. But we, Breastfeeding Promotion Network of India, IPNs, Foxian,
yeah,
IYSAFE, all these should work together and press government to make a law so that it will be properly implemented and this misuse of human milk bank can be avoided. Otherwise,
correct,
it is slowly commercialization of the human milk bank the companies are doing, and we are just helpless because there is no any controlling authority. So
correct.
there's a nice suggestion, ma'am. We will definitely go for that. Madam, you have done a lot of work, exemplary work in baby friendly hospital initiative. Again, that's a pioneer work done by you. Do you think that we have now many IOS safe practices like
Mm.
WHO standards are there, and our country also have good guidelines on IOS safe. But do you think still there is a need of IOS safe guidelines or IOS safe work or BFHI in the current era? Baby friendly
I
hospital initiative. Yeah,
I think there is time for change. You know what happens whenever they started, and usually this is started by UNICEF, WHO, and it is started at one period of time. So I think IYCF was many years ago. And
yeah,
as the time goes on and has been changes, then these things should be included in the syllabus. And it's
curriculum.
because curriculum, and especially because now what we know, at that time we didn't have enough evidence to show the benefits of human milk, to the first few days for the preterm, for the sick newborn, the lives that one can save. And therefore, this should be included in the curriculum. And that's what we have to work with. And I always say that these curriculums were made at one time, whatever it is, international. But I think people like us who work in India, who work at it, all of you all who put heart and soul, must work towards it and include it.
Yes. So that the PGs or students they come to know there's a role of
Correct.
IYSAFE so that they become future doctors of any specialty. At least
Correct.
they
It
know the
does much.
guidelines and implemented. Yeah,
Yeah.
exactly. Secondly, madam, you are a founder trustee of organization NGO SNEHA, that is Society for Nutrition, Education and Health Action. So it's very, I know again, your pioneer work for SNEHA. You have done a lot of work for underprivileged sector of people, masses. What was your dream and how far you have achieved the goals, what you had dreamed long back?
Okay. You know what, Alka, let me tell you. I worked, I said, for 30 years in Sion Hospital where the poorest people, most vulnerable people came. And then in due time, initially we didn't have, but in due time, we had a NICU, a special baby care unit, and we had the best of facilities, ventilation, and we could save the tiniest of babies. But what I realized that despite the best facilities we had in intensive care, mothers came in late. babies were already asphyxiated. So then, when we saved them, really, what happened? They were resuscitated, they were ventilated, but they had all the effects of, of severe asphyxia. They could have seizures, they could have mental retardation, cerebral palsy. And this was, so I was thinking that I always felt when I was in the intensive care head of, I said, what are we doing? We are trying to save lives, but we have come into the picture very late. So at that time, when I was still at Sion Hospital, I decided that when I retire, I was then the dean of the hospital. I said, when I retire, I'm not going to work in any hospital. I'm going from the hospital, jump the walls from Sion into Dharavi, the slum, the largest slum of Asia at that time. I said, I'm going to work there and I'm going to work in those people's communities, in their homes with those mothers to ensure that they know what is antenatal care. They know high risk things. They know how to look after themselves. They know when to come to the hospital. So if we work with them at that stage, they would reach the hospital on time and save the babies. So instead of treating sick babies, we are preventing babies from going to intensive care area. And that's how
Yes.
I first started Sneha. But I started with maternal newborn health because that was, if you have to save babies, the mother has to be looked after. So it was maternal newborn health, and we worked across one slum that time, and I'll tell you why we went. But afterwards, I also worked on nutrition. Then we went to adolescent health, violence against women across that, and finally palliative care. So actually today we work on the life cycle of the woman from antenatal, natal, child, adolescent, and palliative care. So it is the life cycle. So what was my dream and where I have achieved? My dream actually, Alka, was very small. My dream was when I leave the hospital, I'm not going to work in other hospitals, no professors, no deanships for me. I'll be in the slums. And I thought I'll be in Dharavi slum where my patients came from. But today, 25 years later that I started Sneha, we across the most vulnerable slums across the city. We
Yes.
work, we are working in 7 cities. We started maternal newborn health with one municipal corporation, that is Mumbai. Now we are in 7 municipal corporations. So this is not the dream I had. It tells me I am a great believer. You sow the seed somewhere, small seed, and God grows it and takes it to the state it is. Today, I started with one social worker. Today, we have more than 500 staff across all our projects. So it has grown beyond my dreams and taken roots across so many states in the country. And I think more than that, we've decided what Sneha does is we have all our work is recorded. Our community officers all have their phones where data is recorded at the doorstep. So today we are starting a knowledge center. So we are not going from one state to another. Through our knowledge center, whoever wants to learn, it could be governments, NGOs, they get in touch with us and we are in a position to train them. We've done a lot of research, published in national, international journals. So we are now in a position to teach and take what we've done across the country and elsewhere.
Yeah.
Beyond my dreams.
Yeah, truly. Actually, in Marathi, the word Sneha means love. So
Love, yes,
actually, it's a love for all that must have inspired you in that era to pioneer work in this field. That is
yeah,
not only for nutrition, for everything, right
yeah,
from adolescent to pre-marital to after marriage, child, and all those all inclusive work we have done. So really, I appreciate because it was very difficult to work, particularly the era where the people had no ideas about this woman will
correct.
violence and all those things. So really, it should be inspiration for youngsters, young doctors who want to give some time for the society. Madam, you are one of the entrepreneurs who help to improve public health services because many times when public health is discussed in society, it's like a negative approach. Just because they want to serve in the government department, just they are having their service hours and then having a salary, etc., etc. So you have created an impact as far as public health services are concerned. So what is your experience, or one of the just experience you can quote in your public health department in the initial period?
I'll tell you, Sneha does not work alone. We partner with all public health services. You know, when we work with maternal newborn health, we work with Municipal Corporation of Greater Mumbai that has medical colleges, peripheral hospitals, and all across them. So that is a one great partner. When we work with nutrition, we work with ICDS. So they are
Okay.
our second big partner.
Partner.
We work violence against women. Our partner is the police and the free legal aid system. I tell you, I have worked with the government for municipal corporation for over 30 years. I tell you, there are
Mm,
enough good people in the public health system. If we
mm,
all get together, we can change the picture of health in this, at least in our city, in your city, in the country. But we must get together and we must work in partners. What we do is we sit and criticize. Of course, everybody has good points and bad points. Don't keep on harping on the bad things. Think of the good things and work through those good systems. So my experience with public health system has been really good. They've helped at every stage, and if we have been able to do what we did, it is only because we partnered with them. So I have a
wow.
very positive idea of public health systems.
Yeah, exactly. Because there are good people in society, bad people. So always try to see good qualities from a good people so that the progress
Absolutely.
will be there. It will be like next to God, we can say.
Correct.
Madam, in Marathi, we say Dudha Ganga, Ganges, like milk,
Yes, milk.
Dudachi Ganga, like that.
Oh,
Snehachi Ganga. So love and breast milk, I think these are the things we are very closely associated. And your Sneha and human being banking work is actually a very standard example where we can mix love with breast milk and breast milk
uh,
with love. So I
correct.
appreciate because we are the people who have followed you, who have followed your work and taken inspiration from you, so that we can work something for the society, because we are the no, we belong to noble profession. But apart from noble profession, we should do something for the society, and that's the
Correct.
inspiration you have given us to work in this field. Madam, you have also addressed and worked for violence against women and children, of course, of the underprivileged sector or urban poor health, poor class of people. Narrate your journey in this field, because violence against women, nowadays we have association, we have sub chapters also in Fogsi. You are working since many years for violence against women and children. So, what is your experience, or what you want to tell on this topic?
So I'll tell you, Alka, when I was professor of neonatology at Science, one of our mortality meetings, a 3 day baby, 3 days old baby was raped and brought. And because that horrible, I don't know, won't call him a human being, not even animals are like that. He cut the baby and we lost that baby. And, the mother was discharged. We didn't know what happened, who was the culprit. And I was saying, what are we doing here? We've seen this baby tortured mother, poor thing from the slums. I don't know where she's gone, and we have no time to follow. So on that day, Alka, I put my hand up and swore to God that when I retire, I will remember this baby and work on violence against women. So from the time I started neonatology, maternal newborn health, nutrition, we started violence against women. And believe me, you'll all have chapters and all now. When we
Yes.
started, there was no one doing violence against women. And we are an NGO, no one was willing to fund also violence against women. They wondered what we did. But we struggled and we slugged. I had one social worker and we started slowly. And then, but today you'll be shocked. This thing of violence against women, we have clinics across the slums of Mumbai. More important than
Yeah.
just clinics, we have a counselor, we have a social worker and all. But we have
Work. Yeah.
volunteers in the slums. We have volunteers, hundreds of volunteers. Women in the slums, they have come forward. We formed groups. They go. We train them. They take the women to the police station. They know how to register the case. So we have a strong in
Yes.
the slum that we work. We work with all these volunteer women as well, plus our staff. We work, like I said, with the pre-legal aid system. We work with the police. We've trained over 1,000 police people. We are in some police stations. We sit with them. In all the medical colleges, we have an OPD for violence against women, and even there's the one-stop center. The first that was started in Mumbai in KEM is run by Sneha. So really, and
Yes.
like in our knowledge center, violence is a very big thing. We've had apps, training, and all on violence. So I think from that child, I think to fight against that one baby that was raped, I think God help us, and
Yeah.
we are
Beginning.
doing a wonderful job of that.
Yes, but because we have no POXO Act is there. Then again,
Yes, yes.
domestic violence. Many acts are there to protect women and child safety. Again, we have sub chapters in Foxy. We have Dhira master trainer who get trained to treat means to react how the violence if anybody
Yes.
attacks on women. So there are many things in a present era, but that was the era when you started the work. That also in the area Dharavi like area, and now you say once we have one stop center in Amravati also. I work
Uh,
in NGO Bharatiya Sri Shakti. So we have also one-stop centers at different
yeah,
places so that a lady can come to that center and have
yeah.
a protection. At the same time, the case goes to police. She goes to police station now.
Yes,
Previously, it was
yes.
not like lady going to police station. Now they go to police station to lodge the complaint, to lodge the FIR. So
Yeah.
that's a very positive, I should say, result of the work done for so many years in the past. Otherwise, there was no word, or you can say there was no any right given to women to go to the police station or to complain against this violence. But now they have
Yeah.
become bold enough and file the complaint.
Correct, correct.
I think a woman should say thank you to you because that was the beginning that you started the work, and now you say there are many women from Dharavi or slums. They go to
All
police
over.
station,
Yes,
file the complaint.
volunteers.
Yeah,
And
volunteers
I think,
also.
you know what, Alka, what made the difference when we started, there was no support. After poor Nirbhaya's death, after that, all this action started. After Nirbhaya's death, but that happened in
Yes.
the 90s, but we had
Yeah,
started
yeah.
already in the 90s.
Again,
After
again.
that,
Yeah,
everybody took cognizance and all this happened.
yeah, yes. The act was labeled as Nirbhaya Act also, and because Nirbhaya started a movement, the Delhi gang rape case, actually that started
Yes,
our
yes,
movement.
yes.
Yeah. Madam, next question. You have used low cost technology for survival of neonates. Exactly what do you want to convey by low cost technology for the survival of neonates?
Okay, I'll tell you what. Today we can't talk about that in today's era. 2025 is much, much later. But what I was when we I first was at Sion Hospital, and I'm talking about 40 years ago. At that time, we had the only thing we had was a lot of sick babies and mothers. But they didn't have the equipment. They didn't have nurses. There wasn't a ward. There was, no protocols to look after babies at all. So, and there were no neonatologists. Remember, babies were looked after by
Yes,
all the gynecologists, obstetricians.
pediatrician.
Sick, sick babies were transferred to pediatrics. By the time
Pediatrician.
they came, it was quite late. So that was what was going on. But there were 6 incubators given by UNICEF to the ward. And when I said the mortality was very high, I was finding out what are the causes of mortality. I realized that one of the causes was we put a baby in an incubator, and within a day, the baby developed sepsis, the baby died. I said, there is
Okay.
something in this incubator. So we took swabs from that incubator, and those swabs grew Pseudomonas, Klebsiella resistant. So these incubators were a death trap. Now, if you know the old UNICEF incubators, they were metallic sort of boxes, and there was
Mhm.
a sort of a tray, and in that tray you had to put water, and the
Okay.
incubator got heated, the water evaporated. Now, to clean that incubator was next to impossible. It was very difficult. First of all, to clean was difficult. Secondly, there was no one to clean. There were no special,
Mm.
you know. ayahs and nurses in that unit.
Yes.
So no one to clean.
Special.
So yeah,
Yes.
so then I said these are death traps. So I had gone to the administration and dean. I said no, we have to get rid of the incubators. I said otherwise babies are put there and they die. So we got rid of the incubators. And then how to keep the babies warm? Municipality,
Yeah.
no money to buy it.
Mm.
So I had to break my head. How am I going to keep these preterm babies? So the things that I did was one is we had a very small room. It was called the premature unit room. Small room. So
Okay.
I put heaters in the room.
Cyanosis.
Yeah, small.
Mm.
At that time, I'm talking about in the 80s,
Long back.
early 80s. So I put the heaters in the room and the room got little warm, but that was not warm enough. Then, depending on the weight of the baby's size, I used to use table lamps. It could be 20,
Mm.
40, 80,
Sharing.
depending on the
Mm.
size of the baby. And luckily, we were in a medical college. So all my MD students were given thesis on how to save babies' lives. So one was given exactly
Yes.
this. So what is how to keep babies warm at whatever temperature. So this was one way. The second way of keeping warm is, I realized that transepidermal water loss takes place to the skin. Skin is very thin. So when the water
Yes.
evaporates, the temperature drops. Evaporation in the process. So I said, if you put oil, there is no evaporation. Then I realized that the baby's
Yes.
temperature was and more important, when we did the blood sample, the fats, triglycerides increased. That was the source of nutrition. The baby didn't need so much milk. That was another thesis.
Okay.
So this was, and this
Mm.
is the important thing was, I said that this is Bombay and we are having this problem. What will people do in rural areas? What will they do in tribal areas?
Yes.
No electricity, even for lamps and all. So, what are the ways they can save the baby's life? That was one. So, one was how to maintain.
Yes.
Second, of course, breastfeeding. I said we don't have to teach them. Every
Yes.
mother. The third thing I did, Alka, which is, I think I used to get people used to get angry with me. I broke the rules. Outside the premature unit, whoever was
Okay.
there first had written no entry. No one was allowed to enter. I took off that board and I threw it out. I said, we have no nurses.
Okay.
So many babies. Who will look after the babies? I told all the mothers, you all come in. So all the mothers came into that unit and they acted as nurses to the baby. I remember at one conference many years ago, it was in Mysore, I think, where I said, low cost technology in saving babies' life. I remember someone was talking about intensive care, and I talked at the same
Yes.
conference on low cost. And
Of
these
course.
mothers
Yes.
came in. I had one mother to one baby. Secondly, I told these people, when a nurse does, what does the nurse do? Suctioning, IV, you know, they are doing
Yes.
nursing procedures. There is no
Yes.
love. But mothers take their babies, hold them
Bonding.
next to their
Yes.
skin, breastfeed them.
Yes.
And what they said is, I love you, you must live. That positive vibes. I always say,
Yes.
babies live not because of doctors, because that mothers loved, that. So I had one mother to one baby. That's one rule that I felt helped babies survive. Other things that happened at that time, again, people, I told you, pediatricians criticized me. I used to keep the mothers, babies next to the mothers. Today, then, after much later, kangaroo mother care and all.
Yes.
Mine was
Yes.
no. I just said to keep the babies, that vibes, positive vibes to the baby. Another thing that happened, which again I was criticized by pediatricians, we didn't have enough time to keep babies. There was a rapid turnover. So
Yes.
babies had to
Government
go
hospital.
home soon. So I said, we have to give tuitions. I said, when our children, we learn to write at 6. Our children learn to write at 3 and 4. Why? They're taught early. So
Yes.
I said, I'm going to teach my babies early. So when the mothers came, even if they were small, put to the breast. Babies used to put, just suck little. Two things
Yes.
happen. One is the mother's milk started coming in, it didn't dry up. And the second, the babies learned to suck. early. And today, of course, non-nutritive sucking, and they call
Yes.
it all papers being
NNSS.
published. In those days, I feel
Yes.
people laughed at me, saying that, what are you doing? No sucking, swallowing. What will happen to the baby? I said, I'm Sion Hospital.
Acha.
I have to give tuitions. I have to give them tuitions so that suck early, breast milk
Yes.
is continued enough. So like this, I can't tell you how many low cost. These are some of the low
Yes.
cost
Yes.
technologies that I use to get babies to survive, and people could use it any part of the country. You don't need a big hospital. So that's some of the low cost technologies.
Yes, actually, it's amazing work by you, madam, because nowadays we understand the importance of skin to skin contact, like a
Yes.
mother's lap is incubator for all these things because of the constant struggle and impact scientific evidence show that this
Mm,
is true. But way back when there was no research, we started
mm,
implementing these things, and that was I should say dawn of these IYC practices. That
mm.
golden era, I should say. Because of that, we learned so many things and we can implement them. Because there is a research work done, and that time it was no actually research had not any proof as such, but because we started those practice and slowly it got implemented also, and now we can prove on evidence based practice. It is
Correct,
like an
correct.
incubator for baby, and love and all this oxytocin reflex, etc., etc.,
Yes,
love
yes.
hormone. We have understood the importance of breastfeeding or early latch. Ma'am, last but one question. You are founder of Romila Palliative Care Center. What motivated you to establish this center? Actually, was there any specific reason why you established Romila Care
Oh,
Center?
so
You
Alka,
are like a
that
pioneer.
yeah, you know what happens that in life, life doesn't always treat you right, but you have to make the best of what you go through. So I had an only daughter called Romila, and I lost her quite early. She had Hodgkin's when she was 16, and then she had bilateral cancer breast. In around about 30, she passed away. But she suffered
Oh,
so much before she passed away. And when I saw her suffering, not only we were watching her suffer, I suffered. My husband's a doctor, the skin specialist. I'm a doctor. We had the best oncologists. We had the best people to deal with her. We couldn't save her. Saving is one, but we saw her suffer. And I said, why did she have to suffer so much? So after I lost her, I went round and asking, why is it, can't we help such patients? Then I realized I didn't know the word palliative care, Alka. I had not heard of palliative care. So they said, yes, there is palliative care. I said, what is it? He says, we can keep the patient pain free and comfortable till the time of death. And I said, oh my God, why didn't someone tell me? Why wasn't so then I said, I will now make sure that other patients will not go through
sure.
what my daughter. So under the Sneha, umbrella of Sneha, under the umbrella of Sneha, people must remember Sneha is not just Sneha, there are many Snehas. We are Sneha Mumbai. So that's how you can get us on the website, Sneha Mumbai. So under that umbrella, I started the Ramla Palliative Care. And what we do, Alka, all life limiting disease, not just cancer. It could be cancer, it could be stroke, bad stroke, it could be Parkinson's, it could be dementia, any motor neuron diseases, all chronic renal failure, cardiac failure that's not responding, or the surgery is all over, all or hepatic failure, all these come under palliative care. So what we do, we have an OPD in Bandra, and we also have now started an OPD in Sion Hospital and OPD in Cooper Hospital. So whichever
Okay.
patients can come to the OPD, they come. But many of the patients can't come to the OPD. So we have to go home to see them. So a doctor, a nurse, a counselor, sometimes a physiotherapist, they go home to see the patient. The doctor treats symptoms. There should be no, the important thing to remember, the treating physician continues treating. Parkinson's doctor treats for Parkinson's, dementia will treat
Yeah.
for dementia, a stroke will treat hypertension. We
Parkinson.
only
Yes.
treat comfort and care, means there should be no pain,
Yes.
no constipation, no cough, all these symptoms that cause or lack of sleep that cause we treat these symptoms. If there are bed sores, catheters, tracheotomies, and all, our nurse helps and trains the family members. And because of the
Yes.
what they face, the depression, the anxiety, even suicidal tendencies, our counselors are there to counsel not only the patients and the caregivers. So here's remember, doctor treats the patient. Palliative care, we treat the patient
Yes.
and the caregivers. That is the important thing.
Yes.
And we are there till the
Yeah.
time of death, till after death. Now, you know what, Alka, what we must remember, us as an NGO, all the services that
Yeah.
we offer are free of cost. We don't charge
Yeah.
at all. And I think it's so important for every doctor, be a gynecologist like obstetrician, pediatrician, neonatologist, physician, to know about palliative care. Don't just prescribe medicines. Don't just operate, okay, go home. You have to make sure that you listen
Sufferings.
to the patient. Listen to the patient, find out the symptoms, and have a palliative approach, or look at palliative care and send your patients for palliative. Continue treating them, but add additional palliative care support. So
Yeah.
that's why I
So they
started.
alleviate the suffering. Yes,
Huh?
yes. And actually, sufferings should be alleviate the sufferings, pain, discomfort. That is more
Yeah,
important. And patient should
correct.
be like sending home is very easy task, but the
Yeah,
discomfort should be reduced.
correct.
Very great work, madam. Humanitarian work. I should say pious work that you are
Uh,
doing since so many years. And
uh,
indeed, the patients must be relieved of the discomfort because of the great palliative care they receive at your
yeah,
center. Madam, actually, there's a long list of lifetime achievement awards. Purandare Outstanding Service Award, PIM Platinum Standard in Healthcare 2013, Ashoka Fellowship in 2004, and the list goes on. Just
mm.
mention about one award that you are very proud of, that you received the award. Just one award. You think in your whole, actually, there are many things you were awarded, but still, just mention one award you would like to mention here on this platform.
I think the first thing I would like to say about awards is it's sometimes embarrassing. You get an
Oh,
award for the work you do, but you don't do it alone. See, I
oh,
get an award for Sneha. I get an award for palliative care. I'm not alone. My whole
yes,
team, those volunteers in the slums, the community officers, the project officers, everybody work, but they catch hold of one person to give the award. So, in a way, award is not mine. The award is for all those who worked with me. Even when I started the Human Welfare, yes, the idea was mine, but who helped? Jayashree Monkar, the
yes,
technician and all of them helped me, finalize it,
yes,
make sure it runs. So awards belong. But I think one award that might have been only for me is the Ashoka Award. It's an international
yes,
award and it is meant for entrepreneurs, social, the
yeah,
term, Bill, great,
yes,
he started, gave the awards, and his award was for, he coined the word social entrepreneur. What do you mean by social
yeah,
entrepreneur? New ideas to impact society, new ideas
okay.
to impact society. So he said that,
Plain
yes,
child, like,
yeah, brainchild, and it impacts society. So I got that award for all the different ideas. Whenever I came across a problem, I had to break my head. What can I do beyond the normal? And I think I've done that
yes,
all my life. And maybe that Ashoka Award stands out among the many awards that I got. But like I said, he gave it to me as an individual, as a social entrepreneur. Other awards I have to
yes,
share with my entire team
yeah.
of people who worked with me.
So I think it is a out of the box thinking, something like innovative ideas
Yes,
that you are claiming because of that you got the award, Ashoka Award. And this is
yeah,
something I think this is the basis for something new, innovative ideas that
yeah,
gives rise to something new concept or new project, I should say. And because of that, our public welfare is sought. So this, I
correct.
think, all this work shows that you had something out of the box thinking
Yeah.
that made you to begin that work, and now you can see the results of that good work, pioneer work, I should say.
When
Madam,
when I
last
started,
message.
I want to just add one thing. When I started thing like a milk bank, I didn't know there was a word called innovative. I used to say when I have a problem, I break
Okay.
my head how to do it, and suddenly some idea comes. Today they call it innovations, but that is it. Finding
Yes. Yes.
and in
Yes.
innovation entrepreneurship
Yes.
is you start one milk bank, then you have hundreds all over. So
Yes.
tell me
Yes.
the last
Now we can
question you
see the
said.
result. Now we can see the result of. Yes. The last question regarding your work, we have seen actually you are inspiration for all of us. But important thing is a one-liner message for our young generation doctors, and of course the audience who are joined today. So just madam, give one-liner message for our audience, for our young generation of doctors. One-liner
Uh,
message.
I think that one liner would be look beyond the boundaries of your medical practice and reach out to those who need you. And that reaching out, it should come, follow your heart and reach out to them. So
Yes.
I think whatever you feel strongly about, why I'm saying out of the boundaries, you'll practice medicine, surgery, clinic, or webinars or talks like this. This is routine. So this is reach out of those boundaries and look at something that comes from your heart. What is it will make you really fulfilled and happy? And then you reach out to that. And if it is social work or people that you can help, that would be a great idea.
Yes. Yeah. Thank you so much, madam. Actually, this is the desire or the innate desire, I should say, that makes you go ahead with the work and inspire others to do the great work. So once again, thank you, madam, for giving such a precious time of yours for our podcast series. And raising help for all is the topic on which we have interrogated with each other. But I think raising help for all was a dream you had started long back. I think WHO also dreams of that. And of course, Fogsi is an organization which has different projects for our patients. And of course, at grassroots levels, we have different sub-chapters also. So on the Fogsi platform, on behalf of Fogsi, I would like to thank you for giving such your precious time for our podcast series, Gyan Pravah. And thank you for visiting our platform. Thank you so much for your great services to mankind, and of course the underprivileged women, I should say children as well, and society as a whole. Thank you so much.
Thank you,
Thank you
Alka.
so much.
My pleasure, really. Bye.
Thank you so
Good
much.
night.
Meet each other. Thank you. Good night. Thank you, support system, Evangel team, for giving us good opportunity to have a podcast series. Thank you, Kripa. Thank you, Rohit. Thank you so much, ma'am.